I'm a behavioral economist. I'm interested in development. I'm at the World Bank now. I'll say a little bit about the unit, just a couple of minutes, where I'm sitting, just about a year old. I'm interested in health, so this was like a great opportunity, but then didn't actually have a great paper to present here that was sort of at the right stage that would really fit everything. So I have done some work on this past. I'm getting some projects started now, which will be perfect for this conference in the next couple of years. And I thought, well, I don't know. And so I was going back and forth with Manish, and I said, well, I have this one project that just got started. So the data is from this year, kind of February to April of this year. I'm not actually sure whether I'm supposed to be presenting it, so don't tweet this one. But it's preliminary, it's the first time presented. I said, well, this is probably the closest I could do, but I don't want to downplay it too much. It's not the most exciting paper in the world, and we had some problems in the implementation and the process and with government. It's just like, oh, that's perfect. Talk about that. People will be interested to hear about that and some of the things that go wrong sometimes. So I am going to present. We do have results, but there were some things that went wrong along the way. The other thing I have to say, so unlike Burke's work that you just heard, which was like this huge project with all these parts and lots of good stuff going on, this is pretty simple, and we came in kind of partway through, which is some of the interesting process side of it. I also should say, although it's health related, but it's with the health workers, so the staff at the primary care facilities. So it's not health behavior sort of on the patient side or on the consumer side. So this is joint with some colleagues of mine at the World Bank, and as hopefully many of you know, but I will advertise it nonetheless. The World Bank puts out a World Development Report every year, which has a different topic, and the 2015 one, which came out in January of last year, was Mind, Society, and Behavior, so kind of behavioral insights, behavioral science. I wasn't involved with it at all, so I can say it was really, really good and well done, and hopefully influential going forward. And then they had to figure out what to do, and so they said, I will set up a unit within the bank to kind of push these ideas. And so that formally came in, sort of just like you heard about the social behavioral sciences team, which I think was September last year was the executive order from Obama, although they'd been working for quite a while before that. Sort of public it was October last year, we had our sort of start kickoff party. So it's the Global Insights Initiative, which the acronym was chosen first here. So what would go well with Jeannie? I think it's a pretty good name. And so it's a unit within the bank in the chief economist's office, so in the sort of researchy arm of the bank, and a lot of what we do is internal consulting to World Bank operational projects, but also working directly with governments and doing some more, and this one will be in that first main category, but as I said, also sometimes working directly with governments and sometimes doing kind of more basic research, just working with researchers, and small. There are 5 of us now in the group. So I'm happy to talk with others about it. So it's basically the nudge unit, the behavioral unit for the World Bank. And so we have a process of sort of diagnosis early on, going and thinking through, sort of picking a concrete behavior and then stepping back. What are all the things that it takes to get there? What are the actions that somebody has to go through? What are the decisions they have to take? What information do they need? How can we potentially intervene? So we try to be really agnostic at that point, not jump to solutions, not think about interventions yet, but really think about all the steps. Really sort of blue sky, what's going on here, what could happen, which one of those are most important, where could we possibly have interventions, maybe pilot test some of those things, and then go into a field experiment. Most of what we're doing, at least early on, is probably RCTs. We're open to other things, but we sort of have to prove ourselves at the beginning. I think that's probably the best way. So we have this nice long process. None of that happened really in this project that I'm going to tell you about, partly because we came in, but the reason I'm telling you about it now is because we have results, which is great. So we actually have data within a few months of our unit starting, which I think was pretty exciting. But that was partly because we came in partway through. So it was kind of like they had this going on. They were interested in having some behavioral insight, but they said, we need that by tomorrow. And then nothing happened, and they'd say, oh, no, wait, 2 weeks later, we really need that by tomorrow now. And so we did what we could, and so I'll talk through a little bit of that. In terms of focus areas for this is for Jeannie, for the Global Insights Initiative. We work in anywhere around the world and in any topic, which is nice, at least potentially work in all of those. You can see here some of the ones, and I've been doing more financial decision making recently, which is why I didn't have as much health work, although I'm sort of excited to be getting back into that, and we are doing some health things. But for the purposes of this project kind of fits in the last one there, which I think is a little bit interesting because the others are maybe a little bit more standard, but this thinking about organizational effectiveness, institutional effectiveness, how can we get especially civil groups, like agencies, government agencies, to work differently, to work more efficiently, professionalism, thinking of getting teachers to show up, which is a problem, as many of you know, a large place around the world, police forces, governance, which is like World Bank term for corruption, so think governance. And so here it's the health workers thinking about incentives in a very low resource environment, right, where you can't necessarily do a big cash transfer to get everybody to do more, otherwise you would have raised their salaries in the first place. They have quite low salaries, what can we do there? And the World Bank is we have maybe a comparative advantage in working in this area because we're naturally linked with governments and can talk to them and have a little more ins, which is nice. Okay, so the project here, governments at all levels know remarkably little about how much they actually spend on healthcare, so surprisingly little sometimes. And so you talk to the ministries of health, various places, and of course, there's a number that come up with a number, so there's a number on a piece of paper, but they don't always know where it comes from, they don't necessarily know how accurate it is. And this is true outside health as well, but thinking, particularly applying to health, I'll look at primary healthcare here. So knowing that number well, having something that's roughly accurate for that is important for efficiency, for cost effectiveness. Where do we get the most bang for the buck? Where should we put our health dollars if we want to get the best health outcomes? But also for accountability and leakage, another term here for maybe some of the money disappears along the way, or maybe some of the goods get sold and that doesn't get reported back to the government. And not that's not necessarily. This may be not an ideal world, that's not first best, but in econ speak, maybe that's the second best outcome because, again, salaries are very low and often what you think. So some of this sort of low-level corruption and bribery is existing in an environment where the police or the teachers have sort of below equilibrium, even within that context, maybe below equilibrium salaries, since it's some of what they're getting. But you kind of, that is second best, you kind of want to know about that, and that's not always going to be even second best efficient. So where do these numbers come from? What can we get? Just keeping track of that is important. So instead of going back at the end of the year and saying, how much did you spend on all these things, there's been a push in some cases to at least do small elements because it would be hard to keep this up everywhere all the time, but of more like real-time expenditure tracking. So in our case, it's going to be weekly. So going in and asking at these facilities, these primary health clinics, what they're spending, what's the cash flow in and out. So they're getting a little bit of cash flow in from, we heard about this already sometimes today, from services, registration fees, things like that. So even if nominally a lot of things are free, they are getting money in from patients. They're also selling drugs sometimes to patients, legal drugs, medical drugs to patients. And they're getting drugs sometimes from the government, from the central government, and they're getting cash sometimes from the central government. So we're not really thinking about staff salaries, but almost anything else that's going through the clinic or the facility here as well. But why should they bother doing this? Why should the staff bother doing it and participating and keeping good records? If anything, there might be incentives in the other direction, but even ignoring that, it's just one more thing for them to do. And to the extent that they're mission-driven, that they're there because they want to help people, then they're going to be mission-driven to do things to help people, to help the patients. And this is going to look like some boring, because it is a little bit boring, requirement from the central government to keep track of and add up a bunch of numbers, and that's not going to be the highest priority in the main case. So we're thinking about ways how to incentivize that so that we can get better data, so we can do more cost-effective health interventions. That's the sort of overall picture from the policy side. From the research side, and I'll say more about this, we'll talk about the particular interventions, we want to think about how to incentivize public sector, public services in a low-cost way. And so the behavioral side comes in. One of ours is going to be sort of purely behavioral. The other intervention you'll see is sort of somewhere in between. It's not that well-defined a term, but low cost in both cases, relatively low cost. So we want to test those. It's going to be an RCT here. We want to evaluate those and see what works best. Are there ways to do this? It may depend a little bit on the context, of course. That's fine. So I'll go into that more. But then there's been this recent literature, and of course it goes back before these papers, and it comes up in a lot of other papers, just sort of the broader external validity question, but in particular, doing the same thing in different settings or potentially with different partners and getting different outcomes. Not a surprise, right? But kind of pushed under the rug sometimes. We don't really always want to think about that all the time. And this Hunt Alcott and Senlamal Nathan have a nice paper where they look at, so Hunt's the guy who's done a lot of the O-Power, like energy usage studies in the US. And so they looked at some partners there, and they looked at, I think, microfinance institutions. I forget whether it was India or Africa for that, but MFI partners, and they find different, and they implement the same intervention in each of these cases, and they find different treatment effects which are predictable based on observable characteristics of the partners. So not just you get different treatment effects, but there's reasons why you're getting this different treatment effects. Again, not surprisingly, but the people who sign up, the microfinance institution who signs up to work with you as a researcher to evaluate what they're doing is different than the average microfinance institution in the world. Right? So again, not a surprise, but not something we always think about, or think about how do we control for that, how should we adjust our parameters and our characteristics that way. So there's people have been a little bit more explicitly focusing on that recently, and we'll have a small contribution there as well. Okay, so I know some of you have worked in Nigeria, and this is, I was saying to somebody before the talk, I do normally go to the sites and spend some time there and learn about the areas. I have never been to Nigeria. Again, this one came up sort of partway through, so I feel a little bit like an imposter, and I'll be welcome corrections or inputs or interpretations along the way. Obviously, we're working with a lot of people there who know the country very well. And so we're looking in 2 states. I'll tell you a little bit of the differences because that's important. That's what we're going to compare. But Ekiti and Niger. So, well, anyway, so for instance, here, this is the fraction of women with no formal schooling at all by state. And I know it's small, but this is Niger, which is high, and this is Ekiti at the other end, okay? And so if I'm not going to show you the numbers are a little bit lower here, but it's very similar. So Niger, much less education. It's also much more spread out, so it's much larger, transport costs are much higher. In general, think like capacity resources much lower, Ekiti smaller, denser, better educated, wealthier, right? So quite different. I mean, Nigeria is a huge place, so quite different settings, but still, this is 2 places within the same country, in the same general structure, the health service, sort of the same administrative setup, and we're going to be implementing exactly the same intervention, training the people as much as possible the same way. You can see where this is going. All right, so this is in context of a larger World Bank project, which had introduced forms to keep track of income and expenditure streams at these primary health centers along the way. So that's happening in the background. So the forms they're supposed to be filling this out. It's a way to actually keep track. The government didn't really have a good system before that. So develop these forms, they're supposed to be filling them out along the way. There are enumerators going in, monitors, however you think of it, weekly visits, partly directly to build capacity, to talk to people, help them think through the capacity on the administrative side here, and to check on progress. But so in the few months sort of toward the end of last year, after this had been introduced, the overall project is going on. There's no incentives along the way. So there's no incentives to fill out the forms. And of course, there's this general monitoring, which matters, and I'm sure did change things by the enumerators, but they weren't sort of really getting upset at them. They weren't giving them bonuses. They weren't doing anything like that if they actually fill out the forms. And some qualitative work that was before, and then we did some more specific to sort of our intervention as well, says, and I alluded to this already, there's not a lot of motivation for the record keeping sitting there. They don't necessarily see the value, and they have higher priority things to do, which is, again, certainly from their perspective, not unreasonable at all. And even at the slightly higher level, so we talked to the local health committees and committee members, council members, and what they really care is usage. So they're trying to drive up usage at the centers. They're not as interested in this either, and they don't really see the benefits. So the goal here was to come in, can we think of incentives? So this is where they came to us with our team and said, can we think of some low-cost incentives to get people to fill out these forms? It's not going as well as we'd like along the way. So Form C is one of these forms. I'm not going to put it up there. It, as I said, it records all the cash transactions. So everything that's coming in or going out, every cell, different categories of drugs, services, patient fees, anything like that. For a lot of facilities and a lot of weeks, there are a lot of zeros in Form C. There's not much happening. A lot of real zeros, probably some that maybe aren't so real, but a lot of real zeros. And they're actually supposed to, for each day, they're supposed to fill out. So you'll see like there's the heading at the top, what was the balance in this category at the beginning, and 0, 0, 0, 0 on the balance at the bottom. And the next day, same balance at the top, 0, 0, 0, 0, same balance. So they're supposed to be filling this out, and it's okay if they skip the zeros and put the same balance at the top and the bottom, but we want them to be putting something down. So for the incentives, we came up with a checklist, sort of a scoring checklist, based on Form C. So these are the kinds of questions, and you'll see this again a little bit later, but this is the main information, so let me know if you have other questions here. It was sort of like the numerator goes in the week, was Form C filled out before they got there, or was it like they show up and the guy scrambles and says, oh no, everything's the same as it was before, we didn't really spend too much. So that's one question. Did the treasurer or the OIC, the officer in charge, the sort of the head of the facility, check Form C for accuracy? Again, we're just asking them, did they go over it? Are they willing to vouch for what's there? And there are different sections. Are each of those complete? Or are there numbers in there where they're supposed to be? And then a little bit, so that's in some sense all kind of self-reported. We're not going back and comparing that to some real numbers. We don't know what the real numbers are. It's just, are they filling out the form? Then we have a little bit on, for some of the drug things, we do have a way to compare against at least another form that they're filling out to see if it's real or not, does it match up? And then for some things where there should be receipts, we can ask, do they have receipts? And we're not going through every time checking all the numbers, but going to see, all right, can they back this up with a receipt? Are there receipts there? Are they willing to say that? So those are, in some sense, a little bit more real as outcome measures, maybe. And I would believe all of them fairly well. Anyway, that's the scoring checklist. We come up with a numerical score from that, and we'll talk about the incentives. Okay, so how do you get people to do their job? This is a large literature, and some of it relevant, a lot of it potentially relevant, some of it less so. Especially less so around the sort of this public service delivery, where you've got the context of maybe mission-driven organizations, mission-driven incentives, thinking about crowding out. We heard a little bit about that earlier today as well. And then especially in this sort of severely resource-constrained environments where you can't even necessarily give bonuses very easily. And so the two that we're going to look at that we came up with, and would have been nice to do maybe a little more diagnostics, but I think it was a reasonable choice, are social comparison, social recognition, so no material aspect at all, and I'll say, of course, exactly what it was, and then lotteries for a material outcome, for a material incentive. So they get a chance, depending on how well they do on this checklist, higher chance or lower chance at winning. In this case, it's going to be a mobile phone rather than cash, but something material. And so there, the idea is you don't actually have to give out that many mobile phones to potentially have people still be incentivized by that, because this small chance of this big prize is enough to make it very salient to get them to think about it, especially if it's something that they kind of weren't that averse to doing anyway. It was maybe a lower priority for them, maybe it was a little bit of a pain in the neck, but they are supposed to do it as part of their job. Somebody's coming and asking them every week, did you do this or not? And they consider maybe it's just getting them over that hurdle of, okay, well, if I might win a phone for doing this, that's great. I'll do a little bit more. At least that was the idea. That was the hypothesis. So for the social recognition, I won't go too much through the literature. Again, it's smaller, but there's still quite a wide literature here, and there's a couple of survey papers there. Again, not surprisingly, we're humans. We care about what other people think of us, and so just having the boss send you a nice email, something like that, having your name up high on a list, these are the top salespeople, that matters to us. We care about status. We care about recognition and peer support. And maybe compared to material incentives, so this is not an intrinsic incentive, this is extrinsic, this is outside down, this is not sort of homegrown, but maybe compared to some material incentives, it's less likely to crowd out the intrinsic motivation. So maybe it goes along with it. You get the email from the boss saying you did such a great job, thanks for supporting the organization, it really matters a lot to us. Maybe that even builds on, or at the very least doesn't go against whatever intrinsic internal motivation you have, as opposed to there's at least some evidence that might not be true in the external sense. So for trying to get what is there on health work in Africa, I should say, this is starting with the stories on working with partners in this case. So we said, oh, this would be great, and we were looking for something, we're researchers, we were looking for something new to do. I mean, something that has a chance, we hope has a really great chance of succeeding, but something where we're going to learn as much as possible. So we said, oh, we have this idea to do stars, and they said, well, have like stars been used before? And we said, yeah, stars have been used a lot. They said, well, have stars been used at primary health centers in Nigeria before? I said, well, I don't think so. I don't know. I've never heard of anybody doing that. But why would we want to do it if it had already been done there? Well, of course, for them, they're risk averse. They have different incentives, quite reasonably so. They want to really know this is not some crazy thing. So it has been done a little bit in these kinds of settings. So the first one there is not stars, and that's qualitative work, but just the social recognition really matters at all these different levels for healthcare workers. And the paper at the bottom, which I suspect several of you or many of you know, is in Zambia with hairdressers who are sort of on the side, but incentivized, supposed to be doing this, selling female condoms, which are subsidized for the clients. But the question is, how do you incentivize the sellers, the hairdressers? And they found that stars did better than financial bonuses in that case. So that's social recognition. Lotteries, I already said, we have maybe these limited resources. You can't give everybody a lot of money every week to do their job, frankly, but to this particular dimension of their job. So we're going to have a small chance at a large prize. People aren't very good at probabilities. Let's use that to our advantage in this case and say, all right, think more about the outcome, think more about this great thing you could win, and not about what the probability is itself. We don't have to give out too many of them. Should also say, just as a small note here, the sizes of the PhDs varied a lot. None of them are that large. And we said, we'll give the prize to everyone at your facility who's involved with Form C, with doing this and filling it out who's supposed to be. So that we didn't want any sort of competition within the facility. And so sometimes that was one person. And we asked this at baseline, who's involved with it, before they knew. So they can't say, oh, well, it's like me and my friend and my brother, we're all doing this. So we ask at the beginning, before they know what the reason is, who's involved with that there. And then we just say, we're going to give the prize, in this case, a phone, to all of them. So it's been used, again, in a number of different settings. Prize-linked savings is this nice idea if you don't know about. So instead of getting interest, you keep the sort of the capital on your savings, whatever you put into the bank or the credit union or the financial institution, and then instead of getting interest, each sort of dollar of interest or monetary unit of interest is like a lottery ticket. You get a small chance at a big prize. So it's a way to get the sort of behavioral idea that people really like lotteries, but which is fairly regressive, especially in places like the U.S., and to say, let's use it to our advantage to get people to save more, and they always keep that amount, so it's quite safe, and they have a chance to win this large prize. There's a road safety study, I think this was in India, and this is nice because they use loss aversion as well. So all qualified drivers got this chance at the lottery, and then every time you had an infraction, like one of your lottery tickets would get taken away from you. So we really wanted to study loss aversion. We didn't end up doing that here. And then there's been some work, less so in the health setting as well, around medication adherence and weight loss are the two that I know of. Okay, so the interventions are, I'd say, fairly straightforward. We took the score in the checklist, and the results I'm going to show you are sort of analytic results, are going to all use the underlying score on the checklist, in some sense the full set of data. But for what we told them, and to make it sort of simpler, just for a number of reasons, we wanted to transform this. Also, we wanted to get the distributions about right. So we had sort of 1 week, I'll show you 1 week of kind of pilot data, so we knew approximately what the distributions were, and we spread this out, and we made a sort of just an algorithm that would match this into a score from 0 to 5, integer score from 0 to 5 in each of these, and we made it, again, so the distribution it's not going to be exactly normal, but that people are using all the elements there. So we wouldn't have everybody getting 4 and 5, we wouldn't have everybody getting 0, 1, something like that. And those correspond in the two treatments either to stars, the social recognition side, you get 0 to 5 stars each week, and that would change from week to week. And it's physically put up, I'll show you a certificate in a moment, but it's physically put up in like the waiting room of the facility. Or lottery tickets. So you'd get 0 to 5 lottery tickets each week. They just add up over time. At the end, everybody's lottery tickets get thrown in the middle, and we pick out who's the winner from that. So more lottery tickets you get, better chance you have of winning. Right, so here's the certificate. Nina, my colleague, just made this up, so we put them together, but we got permission to say at the bottom, it's small print, it says Ministry of Health Resource Tracking Study, so it says Ministry of Health on it. We got their permission, of course, for that. That was fine. And then, so this is an example if you had 1 star out of 5. But what's important here is that you can see it's out of 5, so they're like the 4 blank stars next to it. And I'm quite sure most of the patients had no idea what the certificate was for. I also know for a fact some of the staff had no idea what the certificate was for because we did qualitative interviews with them either. But the nice thing about it is you don't really have to know what it's for. All you know is somebody came and graded these guys and they got 1 out of 5 on something. So if they care about that, then this might work. Now, maybe not. If it doesn't work, then I have to go back and rethink that and go to the drawing board. But the idea is they should matter. This isn't as much, some of it is sort of competition between facilities. So obviously they can see each other's, and especially in a place like Ekiti where they're close, that's possible. And in Niger it might be harder, but it actually was less so about that than it was about the patients and clients and friends coming in. So it was less about direct competition with each other and more so sort of just who else is gonna see it over time. Again, change every week. Okay, so evaluation design, we had some, we went around in circles a little bit here. So the sample size is fairly small. Obviously, this is the facility level randomization. So we have 65 in Ekiti, and we thought at first we were only going to be able to work there. It wasn't clear whether we were going to be able to do anything in Niger at all. So as I said, the possible 75. In the end, we did. I'll show it to you. I'll show you the results separately by state because we stratified. We did separately there. But so pretty small numbers either way. So ideally, our first thought was we want a control arm, we want a social recognition arm, and we want 2 lottery arms because we wanted this loss aversion, the sort of gain framing and the loss framing. And it was just clear there was no way we're going to have the sample size to be able to do that, the power to be able to do that. So okay, so we got rid of loss aversion. We think, all right, we'll just do lottery, social recognition, and the control. But that looked, especially when we thought we might only be able to look in Ekiti, or when we wanted to at least be able to evaluate separately in the 2 cases, having this sort of 65 and 3 arms, what kind of effect are we going to have? We don't really know how big the impact is going to be here. So that looked risky. So we came up with what I thought was a pretty good plan, and we said, all right, well, we'll just split, and we'll do in Ekiti we'll do control versus social, and in Niger we'll do social versus lottery. Now, obviously, we lose some of the external validity. We both can't test it. We're not sure that it's there. But that gets us sort of both of the 2 main comparisons that we're interested in. Is there effect of this social recognition, and is there a larger effect potentially of the lottery, or an effect of the lottery as well? And so that's what we proposed. Again, after spending a fair amount of time sort of thinking through the different possibilities, and there's risks and trade-offs in each case, and then the government said, no, you can't do that. You have to implement the same thing on both of them, because they thought that would be, maybe more fair. And again, we weren't, on principle, opposed to that. In fact, we liked the idea of being able to do the same thing in both cases and to be able to compare to get at this external validity question, but we couldn't figure out how to do it. So our next best, again, it's a trade-off was, and so here's another sort of process thing. There was supposed to have been 4 months of data just for our part, and meanwhile, all these things going back and forth, time is going by, time is going by, time is going by. So real time is going by. You're all familiar with this. The deadline, sometimes the deadline also moves out. Maybe it moves out more slowly, maybe it moves out faster. That's, there's good and bad for that. In this case, the deadline just sat there because the overall project had to be done by a particular time because it was a contract with the government. So real time is moving. The end time is sitting there. We're getting closer and closer. So we're down to 2 months of implementation, which is only 8 or 9 data points because it's 1 per week for each of these facilities. So we really didn't want to do this, but we thought, all right, the only way, either we just have to give up on one of the treatments entirely, or we'll split the time in half, and we'll do one of them in the first half and one of them in the second half, so kind of like a phase-in. So that's what we ended up doing, and that has problems both potentially in terms of power, because now we're going to get fewer data points in each one, it's going to be noisier, but also, as you'll see in the results as well, that depending on what happens in the first half and what the trends are there, it may or may not be difficult to interpret what happens in the second half, because it's not going to be clean, because they'll already have spent 4 weeks of something, and now we're gonna introduce a new intervention. So specifically what we did is, so we had 9 weeks, but week 0 is what I'm calling the baseline here. So week 0 is the first time so they've been doing this Form C, at least in theory, the Form C has been there. Week 0 is the first time there's a checklist. And so the enumerators are going in saying, and asking the questions. It's not a checklist that they fill out, it's a checklist for the enumerators saying, did you go through, did you complete, I want to look at your Form C, I want to ask you about the receipts. And then we can turn that into a score. There's no actual scoring in the implementation in week 0. There's no intervention then. And so then weeks 1 through 4, we randomize within each state. There's the control group, the comparison group, which just, again, the numerator is coming in. Now, of course, this is not a pure control. This is enumerators coming in every week asking you, did you fill out Form C? That's going to change behavior. Clearly, that's going to change behavior. But since we needed to get the data, as in many cases, there's not a whole lot we can do about that. So that's our version of a control. There are just no incentives. And then in the other half, we have the social recognition, where they're getting these stars. They're getting a score, so they're getting some feedback. So the comparison group is not even being told what their score is, so that's potentially important as well. They're not getting feedback on how they're doing, although of course they know exactly the questions that they're being asked, and they know whether they're saying yes or no, whether they did each of the things, but they're not getting anything like this overall score. Social recognition, they're getting the score, they're getting the stars that goes up there. And then in the second half, for the last 4 weeks, we leave the social recognition groups. They're just the same thing moving along. It was partly going to be too complicated to do anything else. And then we introduce the lottery in the facilities that have been randomized into the control group. So now they're told, okay, from now on, of course, they're told in advance. It only potentially works if they know this is going to happen. They're told from now on, so at the sort of end of week 4, they're told, starting next week, we're going to keep asking you these questions. We're going to give you a score between 0 and 4. That score will correspond to the number of then lottery tickets you get. There's going to be a drawing at the end. It was a public drawing. It was a physical drawing. They could show up if they wanted. It was all very sort of transparent at that level. And then you'll potentially win the phone. They're shown a picture of the phone. Questions on the setup? Okay, so I'll show you Niger first 4 weeks. Okay, so vertical axis is the percent score. So again, this is the underlying kind of raw scores on the checklist that we're going to use. So they're getting about 60% of they're saying, I completed this, I didn't complete that, I can find receipts, I can't find receipts. Week 0, so they're exactly the same level. That's good. That's just saying that our randomization worked. Everything should be exactly the same there. There's no difference. Weeks 1 through 4, no difference. Nothing happened. Like exactly the same. All right. So the one advantage of that is that now we have a really clean test for the second half, because nothing at all happened in the first half, so now we really get to see, all right, did the lottery work or not? So trying to look on the bright side here, right? Did the lottery do anything? Is it kick up because now, there hasn't been really particularly learning? I mean, it might be a little bit higher here, but there's it's the same in both, but there's not really an upward trend in either one of them. So what happens in the next 4 weeks? Nothing either, right? So nothing happened at all in Niger. And so, again, we got this clean test of each of them on their own, so that was nice. So we have sort of a pretty clean 0 in each case, but it's a pretty big 0. So we did some qualitative work, and I mean, this was planned already. We were going to go and do that in both cases. And as I said, maybe this is not as surprising. If there's one of them where not much was going to happen, it might have been there. Trust was lower in the government. There was, again, I would say it was a little bit counterbalanced, so I don't want to give this sort of completely negative view of the state. Some things were actually better there, this sort of maybe general equilibrium effect. So the community level organizations were a bit stronger, partly because the government level structures were much weaker there. So for instance, they didn't trust they would get money from the government. There was not as much flowing back and forth between the sort of central government and the local government flowing back and forth. And then there did seem to be worse communication. So when our qualitative person went in and she talked to them, the percentage of people who sort of understood the interventions, who knew what was going on, was much lower. And the enumerators, it wasn't exactly the same set of enumerators, but it was people who'd been trained the same way, basically the same group of people going out and carrying it out in both states. So they didn't seem to know as much. And there were some other interesting differences there. We're still working through all of the qualitative results. All right, so what about Ekiti? Now we see a nice effect of the social recognition. Okay, and so I'm not going to put up the regression results for this. We have those. It's statistically significant. It's a big gap here. It's starting a little bit higher, not too much higher, but a little bit higher. And there's sort of at least by week 2, there's this clear jump up in the social recognition group, clear difference if you look in week 2 and 3. Now toward the end, and again, this is like 4 data points. Obviously, this is there's a little bit more data points underlying this, but not too much. It's starting to trend up in the control, right? And so on the one hand, I mean, I don't want to read too much into that. I'm curious, and we can talk about that in the discussion a little bit as well, see what people think. They're learning. They're not getting this direct feedback, but they're kind of figuring out, in some sense, what they're supposed to be doing, because they're getting asked this set of questions on, did you fill out these particular things? So it looks like, at least in week 4, it looks like it's trending up a little bit there. And there's still a clear gap by the end, but it's going to make it a little bit harder to interpret what happens in the lottery. And also you can see we're getting up pretty high, especially in the social recognition group. So there's going to be like a ceiling effect here. So if we look at the lottery, so now it's jumped up, and there it's the same. So one would like to take away sort of the naive view, which is not necessarily wrong here, is that the social recognition worked. We can be confident in that, at least at the beginning. Maybe it wasn't necessary. Maybe the control would have gotten there eventually anyway, just from this monitoring. But the social recognition clearly worked, clearly made a difference. So maybe this is saying the lottery works just as well, because they're sort of the same. But maybe it's just that the comparison group was already going up and caught up by then. I mean, it looks to me like a sort of a jump up around the continuing, but obviously I don't want to claim too much on the basis of that. So this was the trouble with the design. We're sort of forced into making these trade-offs. We run into problems, and here it's just now harder to interpret exactly what's going on, hard to draw any firm conclusions of what happened there. Okay, so the clear positive effect of the social recognition, maybe some evidence, depending if you eyeball it, that the control group is improving as well, and say that that's all significant in the regression results, but we can't really say for sure that there's sort of parallel trends or exactly something happening before, which you would want if you're going to do something, a discontinuity or something like that, to say what happens with the lottery, and again, the ceiling effect that I mentioned. So lottery looks like it's doing okay, but not necessarily better. We can't be sure. And then, although there were some issues in the qualitative work here about comprehension, understanding of exactly what the certificates were going on, but as I said before, and maybe not so surprising, people seemed to care about it. They all knew this was happening, and we're talking mostly the staff here. They knew there were these certificates, and so even if they didn't have the complete match from where they were coming from and what they were being graded on, they again, this is not true everywhere, but they seemed to care about the outcome, and of course we see the effect in the data as well. This is disaggregating. So do I guess something like what Burke was saying before as well. So the one place we have an effect, we're going to go and look at where is it coming from. So I know this is kind of small, but this is all the different questions from our checklist and the increases. And so basically all of the ones in terms of completing the facility. So the top is had they filled it out by the time you arrived, did the treasurer check it, the fraction of days of these different elements were complete. All of those are going up, sort of across the board, which is great. The ones at the bottom are, is it consistent, the drug purchases between Form C and this other Form B2? Do they have receipts or invoices to substantiate whatever they're saying? And so those are up, but not as significant and not as large in magnitude. So it looks like it's more coming from the completion side of things. So maybe that's just them saying it, because but again, this is, the social recognition, it's not directly the lottery, they don't understand quite the link as much, they could probably get by with some of the others, so, it's, maybe, we can speculate on that. Okay, so I mentioned this briefly, but one of the important things that came out, which is, and we had thought about this a little bit in advance, and I think this is useful to know, this is just as interesting if this is the effect. We can't completely distinguish, but that just getting this feedback on performance, in some sense, what am I supposed to be doing, even if we had thought, even if the team that had been implementing this already had thought that was clear, that maybe that wasn't entirely clear before. And so now having this sort of explicit, somebody's coming in, talking to you, asking you, did you do this, did you do this, did you do this? You say, oh, I didn't know I was supposed to be filling out this form, or I didn't know I was supposed to be filling out all the parts of this form. I didn't know I was supposed to have receipts, something like that. So that seemed to be helpful, and it seemed to make a difference. And again, maybe that's part of what was happening in the control group, at least in Ekiti. And then, of course, what was really, really, I mean, to be honest, is a little bit ex post that we say, oh, this is a nice test of external validity. That hadn't been our primary motivation to begin with. We weren't even entirely sure we were going to be able to work in both states. But when we were thinking, oh, that just increases our sample size because we were kind of small anyway. We're worried about power. We're going to be able to work on both of them. And then we thought, well, we did at least think in advance before seeing the results. they're pretty different. They're looking quite different this way, and the implementation is quite different. So let's sort of analyze the results quite separately and see what happens. And in some sense, the significance, the power concerns ex post didn't turn out to be that much of a problem, certainly in Niger, where nothing happened anyway, so that was really easy. We can say there's nothing significant, but even in AKT we had actually pretty strong gaps, so it was easily significant there. So everybody trained the same way, same federal. This is not Nigeria versus Bolivia. This is two states in Nigeria, quite different states, but still important to think that even there we should be paying attention to these kinds of things. Okay, so we have this RCT looking at social recognition and lotteries to incentivize the health staff, the healthcare workers on this administrative thing, which maybe was not the most exciting to them. In some ways, maybe not the most exciting to us, but I think broadly generalizable. So obviously, this could be not just for these kinds of forms. It could be not just health workers, but I think lots of places to think about what drives, what motivates, especially this sort of public sector staff. And we do find some effects. So the social recognition, again, not huge surprise. That is, that's the reason why we want to try it. It fits with some other things, but it didn't work in both states. It didn't have to work. And for the government, this was kind of interesting. For the partners, they were a little bit skeptical of this at first. The STARS thing sounded kind of weird to them. We were able to say, all right, this is, it really matters. People do change their behavior from that, or at least it can. That is to say, in one of the states we find it. In some places, previous work we find it. Some places we don't. And that may have been an implementation thing. It's not to say in Niger they don't care about social recognition. It's probably more on the implementation side. No clear evidence around the lotteries or around the long-term, marginal effect of the recognition itself above and beyond the monitoring, which is already some effort to go in. And so in some ways at first we were thinking, oh, wouldn't it be interesting to come back in 6 months or a year and see what was happening? But actually, given the results, I'm not sure it would add that much what was there, because one of them was just flat and the other was up sort of near the top already. Maybe they'd come back down. That'd be interesting. All right, that's it. Thanks. So on the first one, the actual Form C has many rows, and so it's not everything, but it's not just like drugs, it's all different kinds of things. And so we could look, so overall, we weren't going to treat those all as different outcome measures, but we could look and see if there are differential effects. Exactly, we haven't looked at that, so that's a good idea. We can try that. On the second one, so I guess I'm almost certain that at the sort of individual facility staff level, there was no sense of that, is my guess. And we can go back and look at the qualitative work or ask the woman who went and did that. And so partly I think, and this is not to blame my employer because this is common in lots of places, but I think they had this idea for this thing to do, and then they go in and they say, all right, we should do research on tracking spending, pets, public expenditure tracking survey. And so we should go and implement this. And so then somebody says, all right, I'm going to go and implement this. And then it's by the time it's trickled down to what's happening in the field, I suspect it's fairly far removed from why they're doing it overall. That would be a potential intervention, right? To be able to say, and a potential behavioral, low-cost, non-material intervention to say, this is how it fits into the overall perspective. This is why we want this information. This is what's going to happen with it. I think it's a great idea. But my guess is here there wasn't very much of that. I think we did certainly look a little bit at the distribution within each of these, and I think it is mostly they become compliers, and whether that's learning. So it's an interesting question on the cost. Whether that's learning that it's not as hard as they thought it was going to be, not as much of a pain as a hassle as they thought it was going to be, and then they're fine with it, or whether it's just they're the ones who respond, who then they care about the incentives in this case, and so they keep caring, they keep responding to it. I guess it would be. It was removed, yeah.
So you can see that its effects.
The problem is the whole thing was removed, not just the incentives. So yes, that was our natural thought. It was, oh yes, we'll go through. But actually, even the monitoring was removed. I mean, the Form C is still there, but this checklist, the sort of going in and asking them to fill it out, is removed. So yes, we wanted to look a little bit at that. Yeah, so obviously we can't. I mean, so there's what do we sort of, what's our best guess from the qualitative work? What do I think is the truth there, and what can we say from the data? From the data, we can't say too much except insofar as the lottery, sort of comparing the lottery effect, which also had this, both the lottery and the social recognition had this sense of feedback, the sort of private feedback, which the control didn't, at least not directly. From the qualitative work, it seemed like that was quite important. So that it was this, it wasn't, I mean, it's hard to say because they also talked about, caring about the stars being up there, but if you pushed me to say my best guess, I would guess more than half of it was coming from the feedback as opposed to this sort of the social structure of the recognition. But that doesn't come from the data. And I would say non-trivial amounts from both. They both came up in part of it, but certainly not to ignore that aspect of it. And that sort of the last comment is, I think you're right. It's a good point that it wasn't that far apart. It was a little bit lower in Niger to begin with, and I think that gives us, I don't know, I want to say a little more confidence, but makes the interpretation of the results from Niger, where it was flat, more interesting. It wasn't automatic that it was going to be no effect there. So the no effect there, I think, is real. It's a real no effect.